joining us today from Henry Ford Oncology Services and the High Risk Breast Clinic Navigator, Angela Egmon. Welcome to the show.
Hi, how are you?
Yeah, I'm great. How are you?
I'm doing pretty good.
Yeah, awesome to have you here. You're a physician's assistant.
Yes, that's
PA.
correct.
And this week, this is amazing, it is National Physician's Assistant Week. Happy PA Week.
Thank you.
So are they doing anything special for you?
We've gotten lots of goodies and snacks, so they keep us well fed.
Fun. And it's also Breast Cancer Awareness Month, and that's where your specialty is.
Yes, it is.
So you should go out to dinner every night this week.
I know.
Well, it's so neat to know that we have these services here in Jackson. And you're a fairly recent graduate of school. Mm-hmm. How did you know you wanted to be in healthcare and specifically a physician's assistant?
Well, I always loved medicine growing up. Human body fascinated me. And then I was lucky to take a class in high school called Exploring Healthcare Careers.
At Milan High School?
No, I actually went to the Early College Alliance. It was a dual enrollment program at Eastern.
Oh, wow.
So I took a class and learned about a physician assistant, and I was sold after that.
Fantastic. And you joined Henry Ford about a year ago?
Yep, a little over a year ago.
How did you choose a specialty to work in oncology and specifically with breast cancer patients?
Well, I really loved on my PA school rotations anything breast and women's health related. Mm-hmm. I was lucky to have a women's health rotation that was very heavy on breast cancer and breast surgeries, as well as my general surgery rotation. We had a lot of breast exposure, so it was just kind of something that sparked my interest.
Well, I have a niece who has been going through breast cancer treatment this whole year. It's a year. Yeah. It's amazing how intense it is, but it seems like that's good. It's a good thing because the treatments and everything have improved quite a bit.
Yeah, they've come a long way.
How many women are diagnosed with breast cancer each year?
So the National Breast Cancer Foundation says that about 376,000 women are diagnosed in 2025. And on average in the U.S., 1 in 8 women are diagnosed with breast cancer. And we also do know, although it's rare, men can also get diagnosed with breast cancer. And in the U.S., there's about 2,800 men diagnosed each year with invasive breast cancer.
We probably all know someone that with breast cancer who's had it or is currently fighting it or has survived.
Yes.
Are there certain factors that can increase a person's risk for developing breast cancer?
Absolutely. Two of the biggest things are family history as well as dense breast tissue. I always say if you have a strong family history or have dense breasts, you should definitely talk to your provider about additional screening to see if there's anything extra you need. And typically mammograms start at age 40. But if you have a family history of family members diagnosed prior to that, you may be indicated for earlier screening. So I always say sometime in your 20s and 30s, talk to your provider and see when that sort of thing should begin for you.
And in the case of my niece, I actually have 2 nieces with breast cancer, have had breast cancer, and they're both in their 30s when they were diagnosed.
Yeah, absolutely. That's why we say always important to be aware of your breasts, how they look and feel, what might be abnormal, and then, like I said, if you have family history, talk to your provider about starting screenings earlier.
So if you are at high risk, the family factors or the dense tissue, are there proactive steps that a woman can take towards early detection and prevention?
Absolutely. So in clinic, I see patients that are high risk, and we spend some time kind of talking about those different recommendations. So typically women that are high risk are recommended to have a breast MRI every year for additional screening, just to help keep a closer eye on their breasts. And then at clinic, we also talk about things like risk reduction medications and even risk reduction mastectomy, so prophylactic removal of the breasts. So we spend some time kind of creating an individualized plan for patients to determine what might be best for them.
Some people will feel that they might have cancer, they'll have a biopsy, no cancer, but even at that point, because they're high risk, they decide that they are going to have surgery. And that's pretty common.
Yeah, very common. And sometimes there are even what we call high-risk pathologies that are technically benign and not considered cancer. But because they're at high risk for turning into cancer, we recommend removing those surgically.
So you've got the assessment. Let's talk about that, because years ago, people did not even want to go in for the screening because it was so uncomfortable.
Yeah.
Has that improved?
So I'd say in terms of mammogram, I think our techs are amazing, especially at Henry Ford Jackson. I always hear great things, and they're really able to make sure that a patient is comfortable. Unfortunately, it's not the most comfortable exam, but they do a pretty good job at making sure that it's not painful for patients. And if it is, they quickly are able to stop and kind of give them time to take a breath and reset.
So being a high risk clinic, it's basically those two factors, the genetics and the type of tissue, dense tissue that you have?
So those are some of the things that do increase risk. Some other things are if you have a known genetic mutation, or like I said, if you have had a high-risk pathology on a biopsy in the past, those also contribute to your risk, as well as everyday things like diet and exercise, smoking, alcohol consumption. Those are all things that can kind of increase your risk.
And there's, in addition to the assessments that you do, a woman can, or a man can do a breast self-exam at home.
Yep.
What's involved with that?
So whenever I'm explaining breast exams to patients, I always say the point is not to know what you're looking for as much as just be familiar how things look and feel and what's normal for you. Some things that I always tell patients to look out for are any skin changes, any rashes that won't go away, any dimpling of the skin or nipple inversion, or if there's any kind of bleeding or discharge from the nipple. Those are all some things that you should notify your provider about.
So people will often see something unusual, a blemish, and they'll go to Google and they'll do an image search.
Yep.
Not a good idea.
Not a good idea. I always tell my patients, don't Google things because you'll just freak yourself out. I try to be on my in-basket fairly often and tell patients to send me a message no matter what it is, and I'm typically back to them within 48 hours.
It must be a very rewarding for you working with people in the high-risk clinic.
Yeah, I really enjoy it. All of my patients are great, and it's fun kind of being on the preventative side. So I get to kind of help encourage patients to do their screenings and see the preventative side of medicine, which has been a lot of fun.
And you really can. You can lower someone's risk and the lessen their chances of ever developing breast cancer. That's going to be exciting for you, but also for women that take advantage of the high-risk breast clinic services. So having local access to support, what does that mean for the patient?
I think local access to healthcare is really important, especially for preventative health, because a lot of patients think, I'm not sick, I don't have any problems, I don't need to go to the doctor. So they skip their screenings, they skip their appointments. But with things, especially with breast cancer, we know when they're found earlier that the treatment outcomes are much better. So those screenings are really important to identify things at early stages. So having the mammograms and MRIs easily accessible to patients increases our ability to detect things early and even in that precancerous stage.
Some cancers, the older you get, the higher the risk. Is it the same with the breast cancers?
For breast cancers, it's kind of like a bell curve because one of the other risk factors is how long you menstruate for. So we see women in their 30s, 40s, 50s kind of have a little bit of a higher risk. And as you get kind of outside of menopause into your 70s, the risk kind of goes down a little bit.
Are there lifestyle modifications that you recommend for someone with high risk?
Yeah, I always recommend getting at least 150 minutes of exercise a week. Anything that gets your heart rate up. So it doesn't have to be anything crazy, even if it's just a brisk walk, that'll do. And then a healthy diet and lean proteins, dark leafy vegetables, flaxseed, nuts, all those things are good for your body and can help decrease risk of cancer.
Are there medications as well that are part of any regimen?
So we do talk about risk reduction medications. We typically use them in a select few patients, but that's something that we do kind of go over at a patient's appointment if that's something that they would qualify for.
And your clinic is accredited. What does that mean?
It is. So we are what we call NAPBC accredited. So that is a accreditation designated by the American College of Surgeons. In Michigan, there's 25 sites that are accredited, and 8 of them are Henry Ford Health Systems, which is great.
Including right here in Jackson.
Yep, right here in Jackson.
And you're in the professional building?
Yes.
Awesome. Well, thanks for being here. Thanks for all that you and your oncology team do. Who are the docs?
I work very closely with Dr. Hirth and Dr. Francis.
Awesome. Great people. Good to see you. Thanks for coming in today.
Awesome. Thank you.
It's Henry Ford Wellness Wednesday, today featuring from Henry Ford Oncology Services and the High Risk Breast Clinic, Angela Egmon. More to come on today's show. We've got